If you ask different lupus patients to describe their disease in one word, you'd hear a lot of different answers. I'm sure you'd hear scary. I'm sure you'd hear unpredictable. I'm sure you'd hear painful. I'm sure you'd hear life-altering. And I would agree with all of those descriptions. They've been true for me. Lupus has been painful. It has been scary, life-altering, and unpredictable. But I think the word that best describes lupus for me is frustrating. The diagnostic process has definitely been frustrating. In 2008, I started having symptoms, and they started out as pains, different pains in different places of my body. They would come and they would go, and I didn't think a whole lot of them at first, but some of them would start getting bad, like my shoulder pain got to the point where I couldn't lift my arm above my head, so we thought, well, better check this out. It's probably not just a pulled muscle. But I would go into the specialist and he'd run his test and there wouldn't be anything wrong, or we'd just find minor problems. When my hands were really bothering me, they found moderate carpal tunnel. But those things are fairly insignificant and people live with those things their whole life. So I just brushed off a lot of the symptoms, but then I started to accrue more and more symptoms. I got anemic. I started having vertigo. I started getting skin rashes. Different minor things, but when they all started happening at the same time, we started thinking that something systemic might be going on. In 2010, I started getting severe abdominal pains, and they were so bad that they were debilitating pains, and my blood pressure would bottom out. So my husband took me to emergency a couple times. One time he called an ambulance, and they couldn't get a reading either, so they took me to emergency, and they couldn't find anything. Well, the last time it happened, Mark said, we're going to the hospital, and we went to emergency, and we're sitting in the parking lot, and I said, Mark, they're starting to go away again. Let's not go in. Because this would happen time and time again, where I'd go see a doctor, and everybody thinks you're a hypochondriac, or I heard over and over again, you're turning 40, this happens, you fall apart. We're sitting in the parking lot, and I said, let's just go home. They're not going to find anything. And Mark said, no, we're going in. So we went in, and they found a tumor and some cysts in my ovaries. And then they did a blood test, and it indicated that I could possibly have cancer. So they sent me to West Clinic, and I had an oncologist do the surgery, and it was benign. But at that point, we were thinking, surely I have cancer, and that's the reason I was having all these other symptoms. But after the surgery, I was great for the first 2 weeks. And what we found out later is that after surgery, they give you steroids, and steroids are one of the medications that they'll give you when you have lupus to control the inflammation. So that's probably why I felt so good. But after the 2-week period, all my symptoms started really to intensify, and I started getting all of them at the same time. My joints hurt all over my body, and I was having trouble opening and closing my hands in the mornings. Sometimes I'd have trouble getting out of bed, and the only thing that would relieve that joint pain was steaming hot showers. And I could usually control it. After a few hours, it would subside and I could go on, but I was getting severe fatigue. So when all those symptoms started to really intensify, my husband and I both knew that something was wrong. We could no longer just brush it off to old age, or me being too sensitive to the pain. That was when my doctor first did a test that would indicate that I might have an autoimmune disease. And when it came back positive, he did further blood tests, and they came back positive. So he sent me to a rheumatologist, and that's when they diagnosed me with lupus. At that point, I was a little bit relieved that yes, something is wrong with me. But they wanted to put me on some pretty serious medications, so I decided to go up to the Johns Hopkins Lupus Center to get a second opinion because I didn't want to go on those medicines unless it was definitely necessary. So we went up there and my diagnosis was confirmed. I did indeed have lupus. I was relieved and I thought surely my frustrations are all gone. But I was soon to learn that the frustrations would definitely continue. There's one thing I learned pretty quick, and that was there is not one size fits all treatment plan for lupus. Every lupus patient is different. It affects their body differently. And what happens is the immune system, instead of attacking antigens, infections, bacteria, those harmful things that can affect your body, it starts attacking healthy tissue. And it can attack anywhere in the body, and it causes inflammation. And that inflammation that happens over and over and over again is what eventually causes permanent damage and scarring. Right now, I see a rheumatologist for my joints and for the overall disease. That's who treats lupus. I see a dermatologist for my skin, and I see a nephrologist for my kidneys. And some people see cardiologists, some people see pulmonologists. It totally depends on the lupus. A big frustration with me has been that there is not a good treatment plan for my lupus. I thought that after I was diagnosed, they would put me on a certain medication and tell me what I should do, what I shouldn't do, and I would feel better. Well, that was over a year ago, and I don't feel a whole lot better. I'm often asked, what does it feel like to have lupus? That can be a difficult question to answer because I look healthy on the outside, but my body is falling apart on the inside. I am the kind of person that likes to honor my commitments, and I've always been a very active, self-motivated, goal-driven person, and now I don't like to make commitments that I can't follow through on, and I don't always know if I will be able to follow through on my commitments, so that's difficult. What I can tell people about how I feel, I always feel like I'm fighting something. I feel like I'm coming down with something. My body's weak, achy, I'm fatigued, and that level definitely goes up and down. My joints always hurt. Sometimes they're a whole lot worse than at other times, but there's always that pain. So it's living with a chronic condition and getting accustomed to it, getting to the point where you can ignore it enough so that those around you don't feel uncomfortable, so that you're not bringing other people down that are around you, and that's the last thing I want to do. Another frustration I have with lupus is that I have no idea where my disease is going to take me. I don't know what it's going to look like in next year or 5 years from now. And there's no guarantees. It's a very unpredictable disease. You don't know what it's going to look like in the future, and you just have to trust that you can handle whatever comes down the road.